Often only thought of as a nuisance rather than a chronic condition, allergies have become a serious problem for millions of Americans. An estimated 50 million Americans suffer from allergies, including indoor, outdoor, food and drug, latex, insect, skin, and eye allergies. Allergy prevalence overall has been increasing since the early 1980s across all age, sex, and racial groups. Ed Neuzil, registered nurse practitioner at Allergy, Sinus and Asthma Family Health Center, explains how allergies can develop at any point in your life and how they test and treat them.
When we look at the allergic reaction and some of the mediators that are released, histamine is the big one that's released right away. Okay, I eat something and my throat starts to close up, or anything that's not normal starts to happen can be a food-related trigger. So even such things as people getting abdominal cramping, unusual bowel symptoms can be related to foods, and this can happen 4, 6, 8 hours after you've eaten, so it doesn't have to be immediate. So there's things called leukotrienes that are also released, but they're produced in the cell after it was triggered. So that way you might respond later and not actually relate it to the fact that you had something in the evening time that your body didn't like. We have several forms of allergy testing here. I mean, the more common that everybody thinks of is that for the airborne allergens, and that's a simple prick test to determine any severe allergens. And then if appropriate, we would do an intradermal test to look for any high-level responses. We also have food allergy testing, which can find and determine whether you have an allergy to different foods. And we usually test for the more common type foods, but what I also tell people, you may have sensitivities that are not what we call IgE mediated. So it's not an allergy, it's a hypersensitivity or an inability to process. If I test somebody and they're allergic to watermelon, they says, what's in watermelon I can be allergic to? And it's not the watermelon you're allergic to, it's the protein that's watermelon. And so that's what you actually have the IgE to. And all these foods are proteins, and that's where we're looking at where we make the IgE. And you can develop that to almost anything. But people that think that milk is an allergy can be, but doesn't necessarily have to be. You can have an intolerance to where you lack a certain enzyme to break down those parts in the milk. So we have not only the allergic, but an inability to process some of these foods. So when we look at food allergies, I mean, they can be mild, but they can be severe, and it doesn't take much.
Ed Neuzil saw so many patients with sinus and allergy issues that he decided to develop his own herbal-enhanced saline spray. Dr. Neuzil's irrigator has earned the coveted parent-tested, parent-approved seal of approval. The herbal-enhanced saline spray was selected by unbiased parent testers seeking effective and easy-to-use products that benefit the entire family. Dr. Neuzil's irrigator nasal spray is available locally, online, and through retailers in more than 25 states and Puerto Rico. You'll find a list of retailers on the irrigator website, which you'll find along with more information about allergies, allergy testing, and treatments at the Allergy, Sinus and Asthma Family Health Center in Lady Lake when you visit the Allergies and Aging story link at yourhometownhealth.com.